So you have a B mode image up there on your screen, and the M7 is a very powerful system, and it has all the modes that come standard on the machine. So the things that we'll talk about next are color Doppler.
Okay.
And you'll see that color Doppler button is labeled on the color, and it'll pop up there, and there'll be a certain box size, and it could come up steered just like you have it there.
Okay.
With color Doppler, you are able to move the box. You can change the box size and do that. Very good. You jumped on that set button.
Well, it's kind of intuitive, yeah,
it is.
But that makes sense.
Yep,
right.
so you've been using the trackball and the set key for so many other things. It's just kind of one of those next logical steps that you might hit that set key. And what that did is it allowed you to change the box size, and then when you hit set again, it allowed you to move the box up and down. Okay. And so you've adjusted your depth, and now we see that
little too much gain there, color gain.
Yep.
Can we go over?
So just like B mode gain, the color gain, or the amount of aliasing, if you will, is controlled by the gain wheel right there.
Oh, okay, so this is always gain.
It is.
No matter what.
Whatever mode is on, yeah, correct.
Okay.
So you can see that you can really turn down the color gain and have less aliasing or color outside of your vessel.
Yep. Okay.
And you can also turn it up if you feel like it's too low.
So by default, I found out that this is the steer.
It is, yep.
Okay.
So just like you've used that in the past to control some other functions, when using the color Doppler, you can use that rotary nav multifunction key to steer the box.
That's nice.
And one thing I want to point out, since I mentioned earlier that there's usually a couple different ways to do things, you can actually use the soft keys again to steer those. So we see that steer is right up there on the screen, and we can use those soft keys to change the direction of the steer as well.
Okay, great.
And then the one more, just for good measure, if we get our cursor back on the screen, and you move that cursor over to steer, you can use that set button to select it and move it, or you can also use that multifunction rotary nav key.
So most of the soft keys are controlled by either the soft key or putting your cursor over and using the set, or using this rotary nav.
Yeah.
Most of them are, depending on what mode you're in, if you're in B mode or color mode or Doppler.
Exactly.
Okay. Pulse
and it allows users then to feel more comfortable in the choice that they make in order to control the settings.
Yeah, because some people don't like going all the way up here to make their, I would
think.
think.
Exactly.
You'd rather keep your stuff right here.
Yep.
Okay.
Yep, and so we've controlled the gain a little bit, and we've also want to talk about the box size which you've changed, because it is important to optimize that box size. And so if we get our cursor away, which you've seen me touch the cursor button a couple times, now when I'm hitting the set key, allows me to make that bigger to fill the vessel, and then adjust my angle and steering as well.
So let's talk about scale and inverting the color box and all of the little nifty things we could do.
Yep, so when we look at the soft keys again, that's where we have the ability to change our scale and our flow state and our steer. There are various things that go along with these modes that we'll talk about. And so for color, you want to make sure that you have an accurate scale level, so that if you're dealing with a vessel that has fast flow or slow flow, it'll allow you to manipulate that scale in order to accommodate that vessel and have the optimal image that you'd want to have on there. So
the higher the scale does what to my image?
So if I have a high scale, I can see that you're going up to 39.5, up to 53, and it'll go even higher. But you can see that because the carotid artery is a somewhat high speed vessel, you're actually losing some of the fill in your vessel as you go higher.
So this is supposed to correlate with the speed, the velocity of the flow flowing in the vessel.
Correct.
Right. Yeah. So these presets should be set as an average velocity of. If I have it on a carotid setting, I really shouldn't have to change my scale that much.
Right.
Right.
Yep. And as a user just getting the system out, or watching this educational video, you won't have to mess with the presets too much. The factory defaults are very good for the settings. It's great to play with, because then you just are more familiar with the machine. And what's good to know is that you can modify any of these things that we talk about, and they won't stay that way unless there's a couple of steps that we can do to lock those, more of a customized default. Okay. And that's something that your clinical application specialist will discuss with you
when they get there.
Yep, you got it.
So flow state.
There's a couple of settings there. Again, the factory default should be very sufficient for what you're doing with the machine prior to having someone to come work with you. But that will control whether it's a lower flowing vessel,
like slow flow.
Correct. Yep, and then you can go up to high as well. And really, again, the factory settings are good.
You're pretty good with that. Yeah. So steering we did. Let's move across these. Oh, inverting the color.
Yep, and so invert, when you do that, it allows you to, depending on which way your box is steered and how your orientation to the vessel is, you'll see that it changes the direction of flow.
Okay. This will tell you when that's the normal setting, and then this is inverted, so on and off.
Yep,
okay.
You got it. And you'll see, there's other, rows of those soft keys and things that you can change. And by all means, I think it's good that any user that feels comfortable playing with it can see that it'll change the image a little bit here and there. And again, knowing that you're not going to hurt the machine or hurt the settings or.
And if I go crazy with my settings, can I just go back to my presets?
You got it. Yeah, exactly. Right. And people do go crazy. I mean, I've walked into some places and they're like, well, yeah, I was changing the.
And then you can't get it back to where you were.
And they'll rattle off a few things that they've changed. I'm like, okay, well, that's fine because. Obviously, prior to having someone like myself arrive there and knowing how to change that to the default setting, they haven't done anything that's irreversible.
You can't break,
Yeah, but it's kind of funny because some people will get into it and they'll start playing.
They'll get nervous about it.
Yeah.
Okay, so packet size. Do we need to? Let's see. What does this do? And you can always try it.
Yeah. Typically, that isn't something that most users will use.
Okay.
Maybe a little bit more of an advanced user may find that they'll mess with that a little bit.
But we won't use that on just this before you get there, before your clinical application person get there. Can we talk about dual?
Absolutely, yeah. So you'll see that when you have the color on that there's an option for dual live. And so if you go ahead and press the dual button, which is just to the right of B mode, you can pull on a dual screen image, and if you select dual live to be on, it'll make it so that if you're doing a vascular study or you want to check the compressibility or to show that a vessel's patent, you could show one side compressible and maybe one side with the color flow.
That's nice. I like that.
Yep, and I see that you're saving some images over
there.
there.
I thought
and so every time you save, you'll see them start to populate over there as little thumbnails on the right side of the screen.
Okay, right here. Great. So then can I pull off color? Probably not.
So if we hit color, it'll just pull you back to a single.
Okay.
Yep, and if we came back to dual, that's actually a post-processing where you have the ability to go between regular
dual
with it on and off. Exactly. So you can kind of jump back and forth between all those modes, whether you have it dual with color or just a single image with color or without color.
So do you have a way to easily get back to, is there one button I could hit to get me out of color, out of dual, everything?
Yes, there is. So you'll see that when you press B, that brings you back just to home, regular old ultrasound without any modes on. Because sometimes you might have accidentally pressed a couple of those buttons and not sure how to get back.
Out of it.
And B mode's the best bet to bring you back to a good old home screen there.
Home. Do you have color power? Doppler?
We do, yes, and power is just below dual.
Okay.
Yep, and you got
says
it.
Power.
It does, yeah. All these buttons are labeled, yeah.
Yes,
so sometimes people go to look at it and they'll, when you're unfamiliar with the machine, all the buttons of ultrasound machines are labeled differently and the layout's different.
Right.
But if you look at the buttons, you'll see, if you take a moment to slow down, you'll see that they're there written for you.
And basically the soft keys here are similar to what it would be on color Doppler.
Correct.
And you can change them the same way, and steering would be the same.
Yep.
Yeah.
Yep.
Okay.
And again, you can use the soft keys as you would up here, or you can use the trackball and the set key, or you can also use the trackball and the rotary nav multifunction key.
Nice. And to get off, you can either hit the power button or you can hit the B.
Correct. Yep.
Okay.
Yep. So you can bring it back to the B mode there.
Okay.
And it's important to note that your power Doppler on the M7 is a very good tool for picking up sensitive low flow states.
Right. Or deep, like a distal ICA or
distal
something
ICA,
like
something where your color Doppler may not be, pack enough punch. Yep.
That's good.
that covers, I mean, most of the basic functions of color Doppler.